Hi guys, welcome to another episode of Natural Fertility with Dr. Jane. Today I'm joined by Katie Redding, one of my practitioners. We're so excited to have you back. And we're going to talk about AMH today. You get to pick the topic because this is what you're seeing in practice. And of course, I'm seeing it as well. But let's dive in. And why did you decide to pick AMH? Let's start with that. And then let's go into what AMH is.
Yeah, I think it's a good topic to discuss because it continues to come up in questions when we meet with couples. It's one of the first things they ask. They're very concerned about it because the doctor has maybe made it a little bit more of a big deal than it is. Not that it's not a big deal, but there's a lot of confusion around it, which then can lead to a lot of false pretenses, maybe, right? A false sense of I need to take action really quickly and this urgency that I'm running out of time simply because of that number. And so,
or IVF is my only option and I need to do it yesterday. Otherwise, I'd say I'm not going to have biological children.
And I just say, no pun intended, but we don't want to put all of our eggs in that basket. So we want to explore that a little bit more today and make sure we can help couples understand what it really is and how it can be beneficial to track those numbers, but then also what other information we need to be gathering.
Absolutely. So let's start with what is the anti-Müllerian hormone? Like what actually is it? And then we'll go into testing. How do we actually assess it?
Yeah, so it does give us insight into what's happening as far as ovarian reserve, right? But it is not a measurement of fertility in and of itself. So it is a hormone produced by the antral follicles made by the granulosa cells, typically.
Of the ovaries. So the follicles, like your ovaries, the ones that are developing, are producing this hormone. I think like that's really important for people to understand. That's why when it's low, you're freaking out because there's not that many follicles that are producing this hormone. And then when it's high, it's because there's too many follicles, but they're not good quality. And we're going to dive into that. But like just the essence of what is the hormone, it is produced by the follicles, the antral follicles, by the granulosa cells within the follicle specifically. So the actual cells, they make this hormone.
Yes. Yeah. So we look at it, and doctors look at it as a measurement of ovarian reserve. But when we look at it without context and without looking at some other hormones, then we can get a false sense of either something that is bad or something that's good, right? If it's too low or too high, we can kind of have some false expectations there.
Yeah. And I think I remember presenting about this at ECO last year at the Cellcore, big Cellcore event, that is like, well, why do we have it in the first place? And it's basically, well, women are born with all of their eggs. So you don't want to ovulate all of your eggs at once. So it kind of is this gatekeeper to make sure that ovulation is controlled and it's smooth. And a woman is recruiting about 20 to 30 follicles per cycle. And then only one gets chosen. Sure, like 2 or 3 if you're talking about twins or triplets, but generally out of 20, so a woman will lose 20 to 30 follicles per cycle. They'll all get recruited, but only one will really respond to the message. And again, we don't really understand yet why one gets chosen versus all of them, but the body definitely has this mechanism that's very smart. And AMH, I see it like a dam. The water is coming through and there is a dam that's preventing from all of it just flooding through, and it's just creeks of it coming. And then eventually, as water keeps going, there's not as much water on the other side as it keeps leaking. And so that's what the AMH is showing us, that like as you get older, the pool of the follicles that's available is less and less and less. There's so many other things that we need to understand because sometimes it looks like, oh my God, it increased all of a sudden. So that's what we're going to talk about. Like, why does it increase all of a sudden?
Well, and it's important to keep in mind that that number doesn't impact egg quality. So when we're talking about quality and quantity, two different discussions. And again, we focus a lot on quantity, and really if the body is going to select one great follicle from that 20 or from 6 or from 10, whatever it is that you do produce that month, what we want to focus on more is quality. And we'll talk about that in a few minutes. But
yeah, let's talk about the testing. So we understand what the anti-Müllerian hormone is and what it's not, if you will. But let's talk about how do you actually test it, and then how often should you test it to understand the truth behind what you're seeing, because we all know that labs fluctuate.
Yeah, so they definitely fluctuate. I think conversation around when should we test, how often, the frequency, what time of the month, Typically earlier, cycle day 2, 3 is when we want to test for this. It's always important, no matter what lab you're testing, that we do it consistently. So same time of the morning, same time of the cycle is probably more important than anything else. The literature actually shows, like, if you test an 18-year-old woman, you're going to get a false reading because things are still changing. So we actually want to check it after age 21, between 21 and 24. As far as getting a healthy one. So you do it too early and then you may be pushed into some type of treatment that's not necessary. But we see a normal AMH would be around 1 to 4, right? Like if you're on the younger age, it's going to be higher. As you get older, it gets less and less as you lose those follicles each month. But from a testing perspective, cycle day 2, 3, same time of the morning, same time of the month, and then testing it more than one time. So if you just have a singular test, again, just like any other lab testing that we're doing, that's only one data point, right?
You can't diagnose based on one test, like never diagnose based on one test.
And while AMH is relatively stable, it declines over time, but it's relatively stable. It still does change. It still does fluctuate, and it can fluctuate even month to month, slightly. So it is important to have more than one data point. Checking it, if it's something that you are concerned about, you should be checking it several cycles in a row to see what that difference is between those, or if it's staying stable.
Yeah, I love what you said about the age. I think that's a really important component, and that actually tells us how long puberty is. Right? So like the female brain will start puberty at around 9 years old, and there'll be about 9 to 11. There's 2 years of a big change. And then you're going to see the breast bud next. And then usually once the breast starts to bud, it's about 1 year to 18 months, maybe 2 years at most, once the period will start. Then the period starts, and let's say that's around 13. The brain won't stop developing, the body won't stop growing and changing until 21 to 24. And if you think about that, it's like, that's a long time. So that's puberty. And then perimenopause, in menopause is the same thing. It's 15 years in there. We don't want to test it before 24. And hopefully not a lot of women have had that done and haven't had faulty diagnosis. But if you had, at least now you know. And then when we're testing it, it's never alone as a marker. You need to test AMH, you need to test LH, you need to test FSH, estradiol, ideally 17-OH progesterone. So that with an ultrasound, you want to make sure that you get an antral follicle count to see how many follicles are actually being recruited every cycle. And we do that between day 8 to 11 or even day 8 to 12, depending on when you ovulate.
And that's definitely, that advice that we give our clients is definitely different than what most women hear from their doctors. They're looking at an antral follicle count very early.
Like day 2 or 3, like they'll look at it on the same time and it's like you can't see anything. There's no follicles that have been recruited yet.
Or nothing. Yeah, like nothing's happened. Nothing. No hormones have changed. Nothing's growing yet.
I think it's really, the testing is really powerful. I love what you said. It's same time of the cycle, same time of the day. You should be fasted. You should know, like no supplements, nothing, no electrolytes or caffeine before you go. You want to preferably have a quote unquote normal day. So you're not sitting in traffic and you're stewing and angry. Like I remember one of my patients, I'm like, what happened before this lab test? Like it is so different. A lot of people don't realize that all of that matters because if your cortisol is really elevated, I mean, there's now studies showing when the cortisol is elevated that you're seeing changes in the microbiome within minutes. Estrogen, progesterone, thyroid, AMH, FSH, LH, like all of those things change. All related. So state that you are in when you're testing is really important. And I'll use an example of, my client, she just did an egg freezing because she was told her AMH is really low for her age. It was like 0.2. She was 38, freaking out, just getting a divorce. So she's like, I'm going to start freezing my eggs. Terrible health, has like Crohn's, super stressed, inflamed. Then her vitamin D was like at 11 or something, which is insane. It should be like 60 to 80. They start giving her shots. They retest her AMH, but nobody told her that. Her AMH went from 0.2 to 1.5 in less than 2 months. I think it was 2 cycles, but her cycle was short. And it's like nobody told her that. They still pushed her into IVF. And when we sat down on that fertility strategy session, I'm like, so your AMH is not as low as you're thinking it is. And she's like, what? And I'm like, well, it says it's right here. What happened in between this and this? She's like, well, I started getting vitamin D shots. I'm like, right, cool. So like you got pushed into this thing. You didn't even know what the test results meant. which is, unfortunate and why we're producing it. But it's important to get it. If you're really concerned about it, like you said, let's do 3 cycles, day 2 and 3 with all the other hormones. So then we can check and see if that's really the problem for you. Now that we tested, yeah, you go, because I know you have lots to add here.
So much thought, so many thoughts about it,
Yes.
right? So, well, why don't we talk about like what's so bad about low AMH and what maybe is not so great about high? Again, a lot of misconceptions about if it's low, then I have to go IVF and my fertility is low. And if it's high, that's actually a good thing. And neither one of those is actually true. So from when we talk about low AMH, that's always scary for many women. Certainly, we could be talking about diminished ovarian reserve. We could be talking about premature ovarian insufficiency. But it's really important, again, if we don't have all of those other markers, we cannot use an AMH diagnostically, right? Like that's not the thing. It could be a low AMH is just natural progression of age because as we get older, it does decline as we lose those follicles. That would be expected. So all of this is also age dependent. If you come to us with an AMH of less than 1 and you're 27, I'm much more concerned than if you come to us at 43 with an AMH of just under 1. Completely different context, right? And then for low AMH, again, just transition towards menopause, we're going to see that really rapidly declining as well. So there's a lot of considerations there. It's really important that we rule out all of those pieces. We like to get lab testing done on cycle day 2, 3, and again on day 19 to see what's going on with hormone signaling. Is this a signal issue? Is this a hormone imbalance issue that's causing this to be too low? We don't need to go down the rabbit hole of DOR or POI, but that diagnosis is also given without a full investigation of what else is happening in that woman's life. Did I miss things there?
No, that's it. And I think the most important thing to remember is that like low AMH does not mean poor egg quality. And if this is a good time to kind of share so people can see, I love this paper on follicular genesis, which is basically the development of the follicles and the process that goes. Again, this is what I talked about at ECO, and I presented on this to help people understand how long it actually takes to influence a follicle. So the 3-month mark is we're talking about the preantral follicles, and this is where the AMH is being released. Then we can see if, okay, AMH is high versus AMH is low, but a lot of people don't talk about the primordial follicles and the primary follicles. These are things that we cannot capture on the ultrasound. So when we see an ultrasound, we're looking at antral follicles when they are quote unquote big enough before, and then you could also track the preovulatory follicle, but you're not going to be able to see the primary or the primordial because they're simply too small. And so when that AMH, it doesn't tell us anything about the quality of the eggs. And so with PCOS, for example, you have high P, you have IMH, but you do not have good quality eggs a lot of the times because there's too many and they're stuck, and they're all stuck over here. So there's always inhibitory factors and stimulatory factors that are going to allow the eggs to progress towards the pre-ovulatory. And one of the inhibitory factors is that AMH. So then it's natural because we don't want to, as a woman, you don't want to ovulate all of your eggs at once. So it is a natural component of why it's there. So that's why when it's getting low, we are starting to get concerned. What I'm seeing in practice, though, the other inhibitory factors is the environmental toxins, it's the pathogens, it's low vitamin D levels, it's the insulin resistance, it's, the excess weight. All of these things that we know, like the environmental components, also inhibit because the follicles are just going to protect themselves. They don't want to grow. They don't want to replicate. It's not a safe environment for them to go on to become a baby. So they just kind of shut down. So when we see, like now when I look at AMH, and I look at someone who's very inflamed, like the patient that I was talking about, with really low vitamin D levels and just nutrient levels in general because of her immune system function, then it's almost like the AMH that you measure, you cannot trust it because there's too many other inhibitory factors. And that's when, well, can I increase AMH? Absolutely you can, but it depends on what is causing that AMH to be low. So for some women, when their inflammation is already low and their nutrients are optimized and all of these things, which we obviously don't see often, then it's like, yeah, this is more of a true representation of what's happening with AMH versus I'm super inflamed, I'm really nutrient deficient. And then the body just kind of goes into shutdown mode. And that's why you want to test it multiple times. But then you also, like we just talked about AMH, FSH, this, but we will test everything because we want to understand what are other things that are inhibiting from the follicle going from this primordial to the pre-ovulatory follicle, why one gets chosen versus it doesn't. I do think it has something to do with mitochondrial function. I do think it has something to do, with overall nutrient levels and all of that stuff, like how much, because the body always wants to make the best and make those adjustments. So the healthier the follicle, the more likely it is going to be recruited. The more dysfunction there is in that follicle, and usually it's going to come down to mitochondrial dysfunction, the less likely it is to be recruited. It doesn't tell us anything about the egg quality. It can be shifted and changed because your follicles are part of you. What else is going on in the environment that either allows those follicles to be recruited and ovulated, for them to continue to stay shut down because it's unsafe, essentially. That's how I see it.
I love when we think about, like, the body is so smart, and it wants to put forth its best, whatever
Yes.
that. So if we think about, like, each month, if the result is not so good, then it is a direct reflection of something that's going on in the body. And I think, so many women, if they have gone through a journey of infertility and it has been months and months or even years of trying, a lot of them have been doing, like, work on their sleep and work on their health and their diet and nutrition and exercise. And so it can still be really confusing. Why am I still experiencing this? But if we haven't dug deeper, there are a lot of hidden stressors that remain there that can be there from childhood or from an exposure you had 20 years ago. And without diving deeper, those things still remain hidden. So we can be working on kind of that low-hanging fruit of diet, nutrition, exercise, those types of things, and still feeling frustrated that we're not getting anywhere with a better outcome from egg quality, the outcome of having a baby.
Or just even feeling better, like I think that's the frustration. And I was in that boat, and correct me if I'm wrong, you were probably in that boat too, where it's like you were putting in a lot of effort into things and it was just not moving. My hope is that you don't go in believing that, oh, that's just the way that my body is and I'm broken and I've taken all these supplements. Like we just had a discussion yesterday on our clinical case study call. It's actually still the same stuff. Like it is minerals, but it's finding the right mineral for the person. Yeah. The ratio of like the sodium, the potassium, the magnesium, the calcium, the zincs, all of those, finding the right ratio and then finding a product that actually works, because there's so many products that are full of trash. Like, and it's so the way that they're sourced, the way that they're encapsulated, the way everything. So
your body changes over time. And if you've made adjustments to it, even one area, it's going to have a domino effect everywhere else. In my earlier practitioner days, it was easy to be like, here's a protocol. This is what we all do. It'll work. And you feel better for a little while, for 4 months or 6 months. And then suddenly you're like, it's not working anymore.
It's not working anymore. Yes.
Because your health is shifted into a new level. And now that needs adjusting again. You might need more of something and less of something else. And that's why testing is so valuable. Having that data is what allows you not only drive compliance, but your tailored supplemental needs. And so we don't have to say, oh, I tried that supplement and it doesn't work. It probably wasn't the right one for you, or the right dose, or the right brand, or the right, formulation. And there's just so many things to consider. And it's why it can get so messy when couples are trying to do this experience completely on their own. We use the expression all the time. It's like throwing spaghetti at the wall when you don't have that data.
For sure. And, if we bring it back to the AMH, it's the reason. So when I talk about the inhibitory factors, now if I know that AMH is inhibited or influenced by the level of inflammation, then my goal is to an oxidative stress, because follicles are sensitive to inflammation and oxidative stress. Now what's causing inflammation? Where is the oxidative stress coming from? And even if we're like, okay, well, this person has extra weight to lose and that's inflammatory and that produces, hormones, it's an endocrine response. It's not just like extra fat, like that's not doing anything. There is an endocrine response that's happening on the back end. Deeper question is like, well, why is that fat hanging around there? And it's like, well, it's the hormonal imbalance. Okay, but why is the hormonal balance in there? And so this is where we get deeper into, let's understand the methylation pathways. And so the methylation pathways is how the body detox, how the body repairs, how the body makes energy. So then if that's not working properly, whatever else you're going to do is probably not going to be as efficient. And I've seen that happen many, many times with my clients who've had chronic Lyme, chronic mold, and they've never addressed methylation. It's like, well, you're missing a really big component in terms of how to support the body. And then it's what else is causing it? Let's look at the pathogens. Is it in the bladder? Is it in the vaginal microbiome? Is it in the seminal microbiome for the men? But, let's talk just about the women. Is it the environmental toxic load? Is there mold? Is there glyphosate? Is there plastics? Because that's the reality of our world. So why are women so much more inflamed? We're all inflamed, but like, why is infertility declining so rapidly? And it's like, well, we have to start looking at our environment. I actually reposted this on socials where it's like, they're finding microplastics. I think the paper was from 2023, microplastics found in ovarian follicle fluid. They still don't know how it's impacting fertility, but this is a warning sign. I'm like, sure we do. You know how it's impacting fertility. What are you talking about? Fertility rates are declining. More and more children are sick. More and more women need IVF. We know the impact. We know the impact.
We don't need a study to tell us that.
Well, you can wait for it, or you could just be like, look at your hormones, look at now we can test these things and we can tell when a woman is unwell, when she's puffy, when she can't sleep, when she's waking up 4 times a night to go to the bathroom. I'm like, what are you, 85? Like, you can't, why are you waking up to pee so often? Oh, I'm just drinking so much water. And then they stop drinking water and they're still waking up to pee. And I'm like, so I guess it wasn't water. Or if it is water, you're just like, you're not absorbing anything. It's just going right through you. So there's so many, we cannot just look at AMH and go, you need IVF. Maybe that's true. But even if you do need IVF, you should do prep work. And that's something that, we've been talking about for a while. I don't care how old you are. If you do 3 months of really good prep work, if you're 47 and you're running out of time, your results will still be better if you just jumped right in and potentially actually ruined your chances of having a baby because you were so inflamed. And they were like, let's dump all of these drugs on you because that will help.
Yeah, I'm glad you talked about methylation. I think it's not talked about enough in any context. In functional medicine, kind of the gold standard, what I was taught is gut health is supreme. Gut health is number one. That is the foundation. And honestly, the more I'm seeing things, I'm like, actually.
It still is, but methylation is pretty up there.
I don't know. For me, I'm like, yeah, but if we don't get those vitamins and nutrients correct and figure out specifically to your body what you need, it makes the gut healing protocol so much harder because your body is still having to work harder for that. So that's something your doctor's not testing. When we talk about methylation, we're not just talking about MTHFR, which is all that, conventional medicine is even slightly concerned about.
Well, I have a podcast with Elisa about that. So we dive onto the MTHFR because it's like, you guys are missing a big piece here. What I would love for women to know around the AMH, first of all, get it tested properly with all of the things, time it correctly, and do it a couple of months in a row if you genuinely want to understand. If you're having a hard time getting it done, like testing from your doctor because they refuse to do it, then it just shows you how broken the system is. The fact that you go to a fertility clinic, which is really an IVF clinic, they do one round of tests, they give you you need IVF, and then this is the next step, and that's it, without any other exploration, that shows you how broken our system is, and that fertility clinics are really IVF clinics, and that's what they should be targeted, that is what they should be naming themselves, because it's not optimizing fertility. It's, if you want to do IVF, come here, and we will do all of the testing and the diagnostics that answers this one question: will IVF work? And if it will, we will push you into that direction. I think it would be so valuable for clinics to do that, because this is where women and couples are just getting so lost. So oh, I'm finally going to get some help when I go to this fertility clinic. No, you're not. You're going to get pushed into IVF because that's all they do. They're IVF clinics. And then if you want to look at how do I need to optimize my fertility, well, you have to stop looking at your reproductive system as separate from everything else, because it's not. Nothing in the body works in isolation. And there's so much fragmentation in the conventional system because, God forbid, my mom goes to the doctor and only one problem today, please. And it's like, but her
We have time
digestion,
for in our 11 minutes.
we have 5 minutes today. Please tell me the one problem that you have. Oh, there's a prescription. And then next time, here's another. And now you end up with 10 different prescriptions and nobody's putting it together for you, how it's all connected. Of course it's connected. And fertility, I think, is this very complex disease. I actually talked about it on the story one time, where it's like, it's so complex because it's not one system. So stop looking for one thing. If your AMH is not good, we are going to test 30 other things before we tell you why it's not good.
We see improvements all the time with it. Yeah.
I mean, I have a 45-year-old and her AMH has been like slowly increasing as we're working. And it's been like 2 years because chronic complex case, we're doing lots of stuff, but I'm like, her AMH is not decreasing. It's increasing even a little bit, not enough, but like it's not going down. And that's because we're decreasing inflammation over time and pathogenic load and all of this stuff.
So it is important to remember it's an important marker, but it's not the end all be all. We can change it if we have the right data about our own bodies to be able to make the changes necessary. Here's what I tell everybody, because we get this question almost every single week when we do lives on Instagram. We get the question, my AMH is low, can I ever have a baby? And I'm like, you know what? You need one good follicle, one good, really high quality egg. And by the way, some good high quality sperm, because that is what it takes. The people in our field say it is a team sport, right? And we need good quality from both rather than quantity.
Yes.
We see males with lower sperm count, but if quality is good, then we have better chances, right? So what we want to just grab every couple and squeeze them and say is, hope is not lost. There are so many things that we can do to improve that quality, and an AMH will never help us measure that.
On its own. Yeah. It's part of the treatment. And then it's when I see the Instagram questions like, oh my God, my AMH is low, help. I'm almost like, I don't know anything about you, but I have symptoms that are running in my head. Are you overweight? Are you constipated? Do you have diarrhea? Are you anxious? Do you sleep well? Is your hair luscious or is it falling out? Do you have acne? And every woman that I have had with low AMH has 4, 5, 6, 7, 8, 10 symptoms. Oh, I have severe migraines. I'm super anxious all the time. I have never had an orgasm during sex because I can't I can't relax. I don't poop properly. It's like, okay, so that's what we have to fix. And that's what will help with the AMH. Don't let the AMH marker be this like end all be all. And what do I do to improve that? It's like, well, let's talk about what is it that we do? What are some physical things that we can do, mental and emotional, like from a stress component? What do we actually do to see those numbers change and improve?
Yeah. So, physically, we want to, our perspective, first of all, let's get some good testing because that will give us the answers. We don't have to go on a hunt to figure out what's wrong. We can actually see, but it's correcting whatever's going on in the body. Insulin resistance, blood sugar imbalances, nutrient
Which is
deficiencies.
so like, it's crazy how important the blood sugar stuff is for fertility. Like, I think people really don't, they do not understand how important it is.
And
they
it's crazy
think
how many women have it.
Yes, it's crazy how many women have it. So like your HbA1c, it should be below 5%. Most women will walk around with a 5.5, 5.6, and even 5.7 before it gets flagged. I have a woman who was at 7.0 and they were still telling her it's unexplained infertility. And she's like, I don't think that it is. And I'm like, that's bananas. Like, I just don't even, you guys are straight up lying to your people now. But blood sugar, like, it's really hard, even for myself. So like, I have diabetes in the family. I remember when I retested, I was at like 5.6 and I was like, 5.6, what's happening? And it's like, oh, my age is different. I'm not lifting as many weights. I'm sitting at a computer more. It's like, it was a combination of all these things. Like, I can't eat that many carbs anymore because I'm not lifting weights. I'm not on my feet coaching people CrossFit or gymnastics or whatever, So I got a walking pad. I dimmed down my carbs. And it's like, if you don't keep an eye on that stuff, next thing you know, and I didn't have it
so
overweight.
easily.
Yeah, like that's it. It goes up so easily and you do not have to be overweight to have it and vice versa. I've seen people who are carrying extra weight but have better blood sugar balance than someone who isn't. So there is a genetic component there for sure. But sorry, I interrupted, but I'm like, blood sugar, people just think that, no, it's fine. And I'm like, I promise you your blood sugar is not fine. Like, I can almost promise you that, unless you are very aware of it and you're tracking it on a regular basis. Because even when we are, it's still so much work.
But physically, we look for other things, like anything that's causing inflammation in the body. It's typically coming from the environment or from gut imbalances, gut infections, vaginal infections. We have microbiomes all over our body. So lots of places
everywhere. But that is the most
can
studied.
go.
The vaginal microbiome is next, but we're getting more, from the oral microbiome to, I mean, it's everything. Nasal, skin, seminal microbiome, uterine, fallopian tubes, ovaries. Like obviously that one is a lot harder to test, so we don't have that much information on it. Menstrual cycle microbiome, like it's bananas.
So, it's important to identify those areas so that we can fix them, because all of this takes time, effort, energy, money, resources to be able to go through a healing journey. A lot of times people struggle with, should I really test all this up front? Is it really that helpful? It is.
I'm glad you said that, because I think having children is one of the most difficult things you will ever do, but it's the most rewarding as well. And I had a conversation with one of my clients, and she's pretty young, like she's 25, struggled in fertility for 3 years. They get pregnant, have a miscarriage because he wasn't taking it seriously. So now he is, and now she's just kind of like apathetic, like, I don't know if I should, like, and they both had some nicotine addiction stuff. And she's like, I just want to indulge into that stuff. Like, I'm just tired, it doesn't feel rewarding to be doing what I'm doing. Do you know why I do what I do? And she like couldn't really understand the question at first. I'm like, no, like, why do you think I want to sit here and help couples get, pregnant? And she's like, well, because it must be like really rewarding to see, people get healthier and have healthy babies. And I'm like, right. What is the emotion that you think I feel when the couple introduces their baby to me after, we worked together for however long? And she's like, joy. I'm like, that's one of them. What's another? And she couldn't name it. And I'm like, it's pride. I'm like, I feel an immense sense of pride because I'm so proud of her and I'm so proud of them, because I know what it took. And I know who she had to become and everything she had to overcome to get to this point of immense amount of joy. And she's really proud too. She's different. And I had, Amy Ropp on the podcast where she says, nice to meet you. Like, it's so nice to meet you, because now she gets to meet this woman that she is a different version of her than she was when she first started. And I was like, I actually see that woman. And so I go, nice to see you instead of nice to meet you. Because it's like, I know who I need her to become. So what we're talking about with this, like, I just want to know how to mix AMH quickly. Fertility is not a quick fix. No. Fertility is complex because it involves every single system in the body, because it's not just your uterus that grows the baby, it's your entire body that gets quote unquote stress put on it. So the liver has to function more, the kidneys have to function more, your stomach has to absorb nutrients better. Nutrients are going to be depleted from your bones, your hair, and your skin if you don't have it in the bloodstream. So it is not one system. So when we're looking just at AMH and you're like, but what's the supplement I can take? No, girl, you're going to have to get the testing done. You're going to have to get your partner on board, and you're going to have to become a different version of yourself. And like, we are here for it, and I want to support you. And I feel this immense amount of pride for my patients, because I'm genuinely proud of everything they had to overcome to get to the other side. And I mean, I've walked through it with them for at least 6 months, if not a year, and some longer. And it just makes that moment so, so, so special. But for you listening, if you're like, but how do I improve my AMH? It's like, it's deciding I'm going to do things differently, and I want to build generational health, and I'm tired of feeling crappy, and I'm tired of, being brushed off and pushed into things. That's what you're committing to when I think you're thinking about changing your AMH. That's how I think about it.
You have to be ready for a transformation and expect that that's going to happen. That's what you're talking about. It is a physical process that we go through. It's emotional, it is mental, it is spiritual. And we often, this is just very, very true in our culture, that we separate everything. We've been taught to do that. And so we have to step back, look at the big picture, and make those shifts in our mindset and in our physical actions, the things that we do in our lives. But it is very transformational. And I think most of our clients, they get about 3 to 4 months in, and that's where they're like, I see what you're talking about. Things are shifting.
One of my clients yesterday, she's like 6 months in, and she's like, I feel like I'm just scratching the surface. And I'm like, right, because you are.
Listen, I'm not going through a fertility journey, but just when you step back and you talk about health, transformation, it is for me, it's been almost a 20-year start.
It's forever.
You know what I mean? Like and it never ends. Like we can't wake up and be like, oh, I'll just take these 5 supplements and I'll look at the sunshine for 10 minutes and I'll take a walk and that's going to fix it. Like it's just, there's more to it than that. And we're always going to have to be listening to our body to see what it needs next and make those changes.
Well, thank you, Katie, for bringing this important topic to the conversation. I think that if you're going to take anything away from this podcast is do not ever test AMH alone. Test it with other hormones, not just day 2 and 3, but also day 19 and 23. Look at the antral follicle count. If you don't like what you're seeing, then connect with us. Connect with a natural fertility expert. See if you can get a deeper look at what's going on with the gut, what's going on with the environmental toxins, what's going on with other infections, vaginal microbiome, seminal microbiome. What could be some of the things that are causing the inflammation and how long have they really been there? Your naturopath, like a good naturopath or a good holistic provider, is worth their weight in gold. Just like I used to say that about personal trainers. I have clients that I've trained that still reach out to me and say, this was the best investment I've ever made. I have reversed my osteoporosis. I'm stronger. I'm so much more confident. Like I don't have any menopausal symptoms, or I got this new job since I started. It's a skill that you're learning that you can then pass down to your children. It is not just, you said, take these 5 supplements and hope that that's enough, because you have to live in this body for the rest of your life, and it's going to change, and the world is changing around you, and you have to learn how to adapt to that. We're all learning that.
Yeah.
Anything else that they need to take away before we log off?
Just a reminder that low AMH it's not the end all, right? And it is not the measure of quality. And that's what we want to go for. Quality over quantity.
100%. Yeah. And that's something that when I thought about it, it's like, hey, in PCOS, women have high AMH. They do not have high quality eggs.
Yeah.
So we cannot just be chasing, oh my God, my AMH is high. Yeah. But what about all the other hormones? I'm always assessing the woman sitting in front of me based on lots of different factors. The testing obviously helps, but then her symptoms, her history, it is not the end all be all. Quality over quantity. Amen. Well, thank you guys so much for being here. If you are interested in working with us, please fill out the application link down below, and we will see you next week.